Well, the FDA has now authorized a saliva test for COVID-19, allowing patients to provide a spit sample in a cup.
The new test could help protect healthcare workers, preventing them from performing more invasive tests that can cause patients to sneeze or gag. In Texas, nasal or throat swabs are still the primary methods of testing for the virus.
But KXAN's Jacqueline Powell found out those could be producing false negatives, leading people to believe they do not have the virus when they actually do.
It comes like this in a container.
Family medicine doctor Brenna Connor has been testing patients for COVID-19 in her Austin and Lakeway offices and is also sending them to drive-through sites.
I have seen some tests that have come back negative, and it just seems very plausible that the patient does have or did have or is recovering from coronavirus.
Connor worries some of her patients may be getting false negatives. She says it could have to do with the type of sample taken. The CDC recommends nasopharyngeal swabs done up the nose versus throat swabs. Connor is taking the CDC's advice.
I have only given my patients that option in my clinic because I believe as a clinician, I'm able to get more of the sample.
But she says many other practices in Central Texas are only doing throat swabs. The State Department of Health Services tells us those have been more widely available than the preferred nasopharyngeal swabs. While DSHS says both nose and throat swabs are more than 90% accurate,
some reports indicate these tests are only 60 to 70% accurate.
Congressman Lloyd Doggett says he's looking into test accuracy.
At least one clinic here in Austin has contacted me with concern about false negatives that can happen. They recommend that if someone is symptomatic, has all the symptoms of coronavirus, but they test negatively, that they continue to quarantine.
Connor gives the same advice.
I'm absolutely telling them that I would not rule it out.
Advising patients to take their symptoms more seriously than the test results. Jacqueline Powell, KXAN News.
Austin Public Health tells us testing sites they are working with are using both throat and nose swabs. It is not said which is more common or how doctors decide which test a patient will receive.